You made it to the Go Commando Show with Fred Galvin. On our new mission, we contend with the naked truths of health, leadership, and overcoming adversity. Now it's time to go Commando.
So you were telling me that you have pain in your wrist.
Yes.
So what I'm doing is I just want to find and see if I can recreate the pain up the chain. And so I know some of these are tender, you told me, but I want to know if any of them create your wrist pain.
That last one right around there.
This one did?
Yes.
So that actually shoots to your pinky side?
A little bit more to the right there, I think, when you're pushing pressure. Yeah, I can feel that.
So it goes here?
Yes.
Okay. So that's number one. Nothing too crazy down here?
I think when you hit right here.
That one?
Yes.
Okay.
And I had a similar problem with the removal of two ganglion cysts, but before I had that, it was shot up my forearm so bad in Afghanistan, I couldn't hardly hold my weapon.
Okay, two-hand squeeze. Let me get my, there you go, do it again. Squeeze harder, 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 harder. You're not gonna hurt me.
Okay.
So there is just a slight weakness, just a hair, a little bit. Did it hurt to squeeze?
Not really.
Okay, how about here? Hold. Hold. Does that bother you at all?
No.
Okay, how about here? Hold. That bother you at all?
No.
Good. Hold. Nothing there either?
No.
Okay, so we'll see what we can do. What about your knee? Tell me about your knee.
Okay, I started noticing this a little bit more a month ago, but it has been ongoing for about a year, but it's just starting to get more irritated. It's right on the inner side of my left knee. I notice it oftentimes when I get up from my desk. I kind of have to move to the right and twist, and it just hurts here versus my opposite leg. That's fine. So I have to be very conscious about how I'm getting up, but it doesn't hurt when I bicycle. It doesn't hurt in the gym or the pool or anywhere else other than when I'm getting up and twisting it just a little, and it's kind of right there, and it's persistent. It always, when I go through that motion, moving to the right.
Popping, clicking,
I don't
issues
hear
on
any-
stairs.
No issues on stairs, no popping or clicking.
Squatting's fine.
Fine.
Okay.
Yes.
So, disclaimer, as a physical therapist, I would do a more formal assessment.
Yes.
If we were doing this for real, we're kind of demonstrating dry needling more for the video than anything else. So we're gonna needle his extensors and probably his vastus medialis. But again, this is more for the video rather than pure treatment because I would do a bigger assessment. So the dry needles are sterile. They come individually packaged. I wear gloves. And we find that referred pain and try to recreate it. So he signed a consent. We've gone through contraindications, all that fun stuff. Does that recreate your pain there?
Yes.
Okay. So when I ask him if it recreates his pain, he's having pain on the pinky side of the wrist. And so the point I'm pushing on creates the pain. Again. You ready?
Yes. I can definitely feel it there.
What you feeling?
It was just a shock down to the wrist.
And so what we're trying to do is we're trying to actually get a passive twitch response. And I've actually gotten a few of those. You probably can't see it on camera, but it creates just a little extension of the hand because I'm on an extensor muscle. There's it again. How would you describe this to somebody who's watching?
Feels like a little electric current being passed through the muscle tissue.
And I'm not using any electrical stimulation. This is all needle today. Okay, so I'm moving down just a little bit. Is that going anywhere?
Not really. I can feel that a little bit.
So I let hip symptoms guide me, but also like tissue density, because I'm looking for those trigger points, those tight bands of muscle fiber. There's a nice little twitch. Doing okay?
Yes.
Not the most pleasant experience, but it's not bad. I guess I should let you say that, huh? There you go. What do you think?
It's good. I know personally in the past, you have done treatments using the dry needling that I've had problems with that area, that muscle for quite a while, and it immediately took it away. And hopefully we'll see with this.
We'll see.
Yes.
One and done is what we call them, are pretty rare, actually.
Yes.
If that's really what your problem is just that tissue tightness, then yeah, that's great. Most of the times you do come back for that retraining and things like that.
Right.
Our average is really probably like 4 to 8 sessions of needling. We needle about once a week, sometimes twice if it's appropriate. So it just kind of depends on the patient, their tolerance, and what's going on,
Yes.
and how much retraining they need. So Fred's having knee pain on the inside of your knee with getting up and pushing.
Yes.
Right? A little bit of rotation. Again, we would do an actual assessment if we were wanted to treat this for real today. We're going to poke around that guy.
Feel there?
Tender or recreates your pain?
Both.
Okay, that's where we'll
More,
start.
it's tender.
Okay. So I'll just search that whole quad area. Not the most pleasant thing.
No.
Still just tender.
Still tender.
That first one recreated your pain though? A little bit.
Right in there is.
Okay.
I know in the past it was painful when you stuck my knee afterwards. I was gonna go to the gym and train through it, and I was like, I can't do it.
So what I tell people to expect afterwards is about 24 to 48 hours of muscle soreness. Should not be pain. It should be achy and sore,
Right.
like you had a pretty hard workout.
That's what I thought.
Most people, I suggest if they're going to use ice or heat, to use heat. Ice will discourage that inflammation process that I'm trying to encourage.
Right.
So heat will be fine, 20 minutes or less. And we'll see how it goes. But I have them do a full 48 hours before they complain. What you feeling?
Feels uncomfortable. A little bit of pain.
You can see some of his jumps maybe on camera. Go. Last one.
Okay.
Yay. How's your wrist? Any change in the wrist?
I
Not sure.
don't feel the pain there, that's for sure.
Okay. That one there?
Yes. I think because all my pain is down on my leg now.
Yeah. So we do a little bit of pistoning, trying to search out those trigger points, trying to make those passive muscle twitches go away. When I think I've found them all, I'm all done. Ta-da!
Okay. We made it.
We made it.
Thank you. And then what's post, you said heat, is there anything else that stretching or doing?
Yes, movement. Do not go home and baby it. So normally what I would do is we would talk through a stretch for you. We would do a quad stretch with a little bit of movement involved. Walking around today, not sitting at a desk for the next couple hours. Only use heat if you need it, if you're really, really that achy.
Yes.
again, ice will decrease that inflammation process, which you would think that you want, but in this case, you actually want the body to go through that process because it's the start of your healing process and that reset.
So I could go ahead and walk, exercise.
Yep.
Okay.
The only thing that limits you are your symptoms.
Okay. Well, thank you very much.
You're welcome.
To all my fellow grunts out there who in your youth felt it was your duty to protect us, I salute you. And thanks to the listeners of the Go Commando Show who labor on the farm, who are sweating on the construction site, putting forth your very best at the office, you are making a difference. Support the Go Commando Show in our pursuit of bringing you the highest quality professionals. Infiltrate the website at gocommandoshow.com, where you can view all of the podcasts and arm your team with incredible deals on health supplements, commando clothing, and equipment. Every time that you get a good deal, it supports the show. What deals? When you purchase anything from the website, Amazon, healthcare supplements, you're covering our six. And to the ladies on the team, when you outfit yourself in the super sexy threads from Naked Zebra, and yes, I'm talking about in a fuego, you are firing the sniper shot for our commandos. How else can you support? It's simple. You smash the follow and subscribe buttons on our social media. That is how you support us bringing great guests to talk about serious subjects, not the mainstream media's fake news. So thank you, and until our next show, stay in the attack and go Commando.